In a previous video, we discussed sensitivity and specificity to measure the diagnostic accuracy of a test. The sensitivity and specificity of a test is considered when choosing a diagnostic test to evaluate patients with conditions such as cervical radiculopathy, lumbar disc herniation, or lumbar spine stenosis. However, after choosing a test and having a test result, sensitivity and specificity are not able to tell us the probability of a patient having a condition based on the positive or negative test result. In this video, we will discuss predictive values and learn about how they can be used to understand the diagnostic accuracy of a test in a real clinical situation. Positive predictive value and negative predictive value measure the probability of a test result being correct, either positive or negative, and can help healthcare providers make decisions about future testing or treatment for their patients. Positive predictive value and negative predictive value are usually expressed in percentages. The higher, the better, same as sensitivity and specificity. They are computed by comparing a new test to a reference standard, which is the best available test to find the condition and therefore assumed to give us a true result. Positive predictive value is the proportion of people who test positive for a condition and actually have the condition. It is calculated by dividing the number of true cases identified by the test by the number of all cases with positive results identified by the test. A positive predictive value tells the probability of having a condition when the test is positive for a patient. For example, if a positive predictive value is 80%, a patient with a positive test result has an 80% of chance to have the condition. Negative predictive value is the proportion of people who test negative for a condition and actually do not have the condition. It is calculated by dividing the number of true negative cases identified by the test by the number of all cases with negative results identified by the test. A negative predictive value tells the probability of not having a condition when the test is negative for a patient. For example, if a negative predictive value is 80%, a patient with a negative test will have an 80% chance of not having the condition. Predictive values answer the question about the presence of a disease after the test result is known. However, the same diagnostic test will have a different predictive value according to the clinical setting in which you are applying it. It is important to note, positive predictive value and negative predictive value are not fixed properties of a test. The positive predictive value and the negative predictive value change based on the specific population being tested and the prevalence of the condition in that population. As we can see from this chart, we have three tests with the same sensitivity and specificity: 80%, 80%, 90%, 90%, and 99%, 99%. The tests can be applied to different clinical settings where the prevalence of the condition is different. When a condition is uncommon, let's say with a prevalence of 1 in 10,000, then the positive predictive value is lower. However, when the prevalence of the condition is high, let's say 1 in 5, then the positive predictive value is much higher. This means if a condition is rare, then a positive test may not truly identify the condition. The lower the prevalence, the lower positive predictive value, even if sensitivity and specificity are high. Let's say there is a diagnostic test for COVID-19 using saliva samples. The sensitivity and specificity of the test is 95% and 95% respectively. This means the test can correctly identify 95% of people who have COVID-19 and 95% of people who do not have COVID-19. For the positive predictive value, let's say the prevalence of COVID-19 in people tested at home is 2%, meaning 2% of people at home have COVID-19. If 1,000 people are tested, 20 of them are likely to have COVID-19. The test has a 95% accuracy rate, so 68 people will be tested positive. Only 19 are likely to have COVID-19. This means the positive predictive value is 19 out of 68, or 27.94%. Let's say the prevalence of COVID-19 in people tested in their emergency department is 30%, meaning 30% of people in the ER have COVID-19. If 1,000 people are tested, 300 of them are likely to have COVID-19. The test has a 95% accuracy rate, so 320 people will be tested positive. Only 285 of them are likely to have COVID-19. This means the positive predictive value is 285 out of 320, or 89.06%. In this example, if someone at home tests positive for COVID-19 using the saliva test, there is a 27.94% chance they actually have the disease. While if someone at ER tests positive, there is a 89.06% chance they actually have the disease. The positive predictive value is lower for the people tested at home than the positive predictive value for the people tested at ER, because the prevalence of COVID-19 in the population being tested at home is lower than the prevalence of population being tested at ER. For negative predictive value, it is interpreted in the same way as positive predictive value. The only difference is negative predictive value indicates the probability of not having a condition. In summary, we choose a test based on its sensitivity and specificity. We interpret test results based on its positive predictive value and negative predictive value to answer the question about the presence or absence of a given condition. Positive predictive value and negative predictive value measure the probability of a positive or negative test result being correct.